Undocumented Immigrants Emergency Medicaid, a drop in the ocean, but a storm of debate. A recent study reveals a shocking disparity in healthcare spending. While the government shutdown persists, a critical discussion emerges. How much does emergency care for undocumented immigrants cost the government? The answer might surprise you. Amidst the ongoing shutdown, now in its 17th day, political debates rage on about Medicaid spending. This includes the contentious issue of health care for undocumented immigrants who are legally ineligible for federal health programs, yet can access emergency care. The Journal of the American Medical Association published groundbreaking research analyzing emergency Medicaid spending in 38 states and Washington, D.C., including California, in 2022. The findings? Emergency Medicaid for undocumented immigrants accounts for less than 1% of total Medicaid spending. Patricia Santos, the study's lead author and an assistant professor at Emory University School of Medicine, emphasizes the minimal fiscal impact of this spending. Any reduction in emergency Medicaid for undocumented immigrants will have a negligible effect on the federal budget, she says. But here's where it gets controversial. The study suggests that such cuts could significantly affect safety net hospitals. The research highlights that emergency Medicaid covers serious medical conditions that could lead to permanent injury, life-threatening illnesses, or childbirth for those who meet regular Medicaid criteria but are undocumented. On average, this accounts for a mere 0.4% of Medicaid's budget. As the administration proposes Medicaid cuts during the shutdown, Santos argues that targeting emergency Medicaid is not an effective way to reduce waste. Instead, it could unfairly burden safety net hospitals. But is this a fair assessment, or does it overlook the broader implications of undocumented immigrants' health care? This AI-assisted article, originally reported on air, has been meticulously verified by our editorial team for accuracy and fairness. The debate continues, and we invite you to share your thoughts. Are these cuts justified, or is there a more nuanced approach needed to address this complex issue?